Did you know that kidney disease affects over 850 million people worldwide? That's more than 1 in 10 adults, making it one of the most common chronic conditions globally. Yet, it's often called a silent killer because many people don't experience symptoms until the disease is in its advanced stages. In fact, studies show that up to 90% of those with kidney disease are unaware they have it, leading to delayed treatment and severe complications. With such staggering numbers, it's clear that kidney disease is not just a personal health issue, it's a global health crisis that demands more awareness and action. Kidney disease is rapidly emerging as a major global health challenge, affecting millions of people across all demographics. Its prevalence is on the rise, fueled by factors such as increasing rates of diabetes, hypertension, obesity, and aging populations worldwide. What makes this condition particularly concerning is its silent nature. Many individuals are unaware they have kidney disease until it progresses to advanced stages, where treatment options become limited and complications more severe. Despite being one of the leading causes of morbidity and mortality, kidneys disease remains underrecognized and underdiagnosed. Studies indicate that up to 90% of people with chronic kidney disease, CKD, are unaware of their condition, largely due to the absence of noticeable symptoms in its early stages. This lack of awareness delays diagnosis and treatment, leading to serious health consequences, including kidney failure, cardiovascular disease, and even premature death. The rising rates of kidney disease, coupled with widespread ignorance about its risks and symptoms, highlight the urgent need for greater public education, early screening initiatives, and improved access to healthcare. By addressing these gaps, we can empower individuals to take proactive steps toward kidney health and prevent this silent epidemic from claiming more lives. Kidney disease presents a complex and multifaceted challenge that affects millions globally, yet it remains largely overlooked in public health discussions. One of the most pressing issues is the lack of awareness and education surrounding the condition. Despite its staggering prevalence, kidney disease often takes a back seat to other chronic illnesses such as heart disease, cancer, and diabetes in public discourse and health campaigns. This lack of visibility perpetuates widespread ignorance about the condition's risk factors, such as high blood pressure, diabetes, and family history. Many individuals are unaware of the vital role kidneys play in maintaining overall health, from filtering waste and toxins to regulating blood pressure and producing essential hormones. Without adequate public knowledge, opportunities for prevention and early intervention are missed, leaving many at risk of developing severe complications. Another critical challenge is the high rate of misdiagnosis or late diagnosis, which significantly hampers effective treatment. Kidney disease is often referred to as a silent killer because it progresses quietly, with few or no noticeable symptoms in its early stages. Symptoms such as fatigue, swelling, and changes in urination are often attributed to other less serious conditions, leading to delays in seeking medical attention. Even when symptoms do appear, they are frequently misunderstood or overlooked by both patients and healthcare providers, resulting in missed opportunities for early detection. By the time many individuals are diagnosed, the disease has often advanced to stages where kidney function is severely compromised, necessitating aggressive treatments like dialysis or transplantation. This delay not only limits treatment options, but also increases the risk of life-threatening complications, including cardiovascular disease and infections. The impact of kidney disease on quality of life is profound and far-reaching. For individuals in the advanced stages of the disease, managing the condition becomes a daily struggle. Treatments like dialysis, which requires spending several hours a week connected to a machine, can be physically exhausting and emotionally draining. Strict dietary and fluid restrictions further complicate everyday life, as patients must constantly monitor their intake to avoid worsening their condition. Beyond the physical toll, kidney disease also exacts a heavy emotional and psychological burden. Feelings of anxiety, depression, and social isolation are common among patients, particularly those who face the uncertainty of waiting for a kidney transplant. The financial strain is another significant factor, as the cost of ongoing treatments, medications, and associated healthcare needs can be overwhelming, especially for those with limited access to resources or insurance coverage. This burden extends to families and caregivers, who often bear the emotional and financial weight of supporting a loved one with a chronic illness. Addressing these challenges requires a comprehensive and collaborative approach. Public health initiatives must prioritize raising awareness about kidney disease through education campaigns that highlight its risk factors, symptoms, and the importance of early screening. Healthcare systems need to improve access to regular kidney function tests, particularly for high-risk populations, to facilitate earlier diagnosis and intervention. Kidney disease can arise from a variety of causes, many of which are closely tied to other chronic health conditions. One of the leading causes is diabetes, responsible for nearly half of all cases of chronic kidney disease, CKD. Elevated blood sugar levels over time can damage the delicate blood vessels in the kidneys, impairing their ability to filter waste effectively. Similarly, hypertension or high blood pressure is another major contributor. The increased pressure on blood vessels can strain the kidneys, leading to scarring and reduced function. Together, these two conditions account for the majority of kidney disease cases globally. Let me tell you today, beyond these primary causes, there are other significant risk factors that increase the likelihood of developing kidney disease. These include obesity, which places extra strain on the kidneys, and genetic predisposition, as family history can play a critical role. Certain ethnic groups, such as African Americans, Hispanics, and South Asians, are at higher risk due to genetic and socioeconomic factors. Additionally, lifestyle choices like smoking, excessive alcohol consumption, and diets high in salt and processed foods can accelerate kidney damage. Age is another factor, as kidney function naturally declines over time, making older adults more susceptible to CKD. Early detection and treatment are crucial in combating kidney disease, yet they remain significant challenges due to the condition's silent progression. Routine screening for kidney function through tests like blood creatinine levels, glomerular filtration rate, GFR, and urine albumin tests can identify issues long before symptoms appear. These tests are particularly important for individuals with diabetes, hypertension, or a family history of kidney disease. Early diagnosis allows for interventions that can slow or even halt the progression of the disease, such as managing blood sugar levels, controlling blood pressure, and adopting healthier lifestyle habits. Treatment strategies for kidney disease depend on the stage of the condition but often focus on addressing the underlying causes. For example, medications to manage blood pressure, such as ACE inhibitors or ARBs, can protect kidney function. Dietary modifications, including reducing salt, protein, and potassium intake, are also essential in managing the disease. In more advanced stages, treatments like dialysis or kidney transplantation become necessary to replace lost kidney function. The importance of early detection cannot be overstated. Identifying kidney disease in its early stages not only improves the chances of effective treatment, but also significantly reduces the risk of severe complications, such as cardiovascular disease, which is a leading cause of death in CKD patients. Public health efforts must emphasize regular screening, especially for high-risk populations, alongside education about risk factors and preventive measures. Let me tell you about Sarah, a 38-year-old teacher and mother of two, whose life was turned upside down by an unexpected diagnosis of kidney disease. For years, Sarah had been feeling fatigued, experiencing swelling in her ankles, and noticing changes in her energy levels, but she attributed these symptoms to the stresses of daily life. It wasn't until a routine checkup revealed elevated blood pressure and abnormal kidney function that she was diagnosed with stage 3 chronic kidney disease, CKD. The news came as a shock. Sarah had no family history of kidney issues and had always considered herself relatively healthy. As Sarah learned more about her condition, she realized how little she knew about kidney disease and its risk factors. Her doctor explained that her poorly managed hypertension, combined with a diet high in processed foods, had likely contributed to the damage over time. With her kidney function already reduced, Sarah had to make significant lifestyle changes, including adhering to a strict low-sodium diet, taking multiple medications, and attending regular medical appointments to monitor her progress. The impact on Sarah's life was profound. She often felt overwhelmed by the physical and emotional toll of managing her condition, balancing work, family responsibilities, and the constant worry about her health. "I didn't know how much my kidneys did until they started failing," she shared. "It's not just about your kidneys. It affects everything, from your heart to your mental health." Despite the challenges, Sarah became an advocate for her own health, committing to a healthier lifestyle and educating others about the importance of early detection. Sarah's story is a stark reminder of the silent and pervasive nature of kidney disease. It highlights how easily symptoms can be overlooked and the dramatic impact the condition can have on every aspect of life. Her journey underscores the importance of awareness, regular checkups, and proactive management in preventing kidney disease from progressing to more severe stages. Sarah now shares her experience to encourage others to prioritize their kidney health, proving that with early intervention and determination, it's possible to reclaim control over your life. Kidney disease is a silent yet widespread health crisis, affecting millions globally and often progressing unnoticed until it's too late. With rising rates fueled by conditions like diabetes and hypertension, the urgency to act has never been greater. Early detection through routine screenings, education about risk factors, and proactive management are key to preventing severe complications and improving quality of life. By increasing awareness and prioritizing kidney health, we can empower individuals to take proactive steps in managing their health before kidney disease reaches advanced stages in our life. Let us know your thoughts on kidney disease in the comments below. Have you or someone you know been impacted? Don't forget to subscribe for more health awareness content and check out our next video on managing chronic conditions effectively. Together, we can spread awareness and make a difference. One love. Bye.